When you go to the dentist, X-rays is one of our very important diagnostic tools because that allows us to see where we cannot see with the naked eye. So there are a number of different kinds of X-rays. They're the small ones that are taken for routine checkups. Those are called bite wings, and essentially those are primarily used to check for cavities between teeth, because obviously we can't see where your teeth are touching up against one another. Another one is called a panoramic X-ray, and that gives us a good overview of your entire mouth. And then of course there are different kinds. There's analog X-rays and digital X-rays. Some of the things that come to mind are, how safe are they? That's an excellent topic, it's an excellent question, because we all want to minimize the amount of radiation that we're exposed to. And there is no such thing as below this amount is totally fine and above this is dangerous. There's no threshold above or below which gives us our safety margin. But let's put things in perspective. One dental X-ray is equivalent to 10 minutes outside on a sunny day. So it's not the same as getting a chest X-ray or a CAT scan. Those are very different things with very different amounts of radiation. So when you go for your dental checkups, those X-rays that they take called bite wings, they do those every year or so. Now everybody's a little bit different. If they are prone to cavities or have issues, then obviously more often would be appropriate. But if you are someone who has had very little problems or very little changes over time, then of course you can do it less frequently. But remember, 10 minutes outside on a sunny day is equivalent to one dental X-ray. And now when it comes to some of the newer machines, our digital X-ray machines, they use less than half. There are two-dimensional X-rays, which we are very used to at the dental office, but now we also have the ability to take 3D images, and we do that when we have to do extensive types of treatments such as wisdom teeth extractions or implant placements. It's unbelievably powerful to be able to see everything that we need to see in 3 dimensions. There's more radiation, and of course there's so much more information. So we do the 3D images when we need that level or that amount of information to do something that is more comprehensive or complicated. Depends on each individual's situation. If you're someone who's more cavity prone or has gum disease related issues, obviously we're going to need more information more frequently. If you're someone who's reasonably healthy and has very few issues, we don't need X-ray images as often. When it comes to frequency, just for some references, for a healthy individual, every year or year and a half or so for the routine bite wings X-rays, which are the ones that we take to check for cavities. However, once every 5 years, it is recommended that we take a full series of X-rays to check absolutely everything. And the difference would be, for instance, having a complete physical versus going for a quick visit to your doctor for something specific. And when it comes to the cost, of course, the more that we take, the higher the cost. So what we want is the maximum amount of diagnostic information for the fewest amount of X-rays taken. And we have to balance those things depending on the individual's needs. Even though there is very little scatter radiation from our newer machines, we still want to err on the side of caution, so we refrain from taking X-rays on pregnant women even with the lead apron on, certainly during the entire pregnancy if possible, but if absolutely necessary, we try to refrain from the first trimester or third trimester. But we want to make sure that we're always playing to safety first. I absolutely want to convey the point that radiographs, X-rays, are a very important diagnostic tool, and we want to use them so that we are making sure we're taking the best possible care of you, but at the same time, we want to make sure that we're doing only what's needed, no more. I hope you found this helpful. Thanks for all your questions. Keep them coming.